Hi, it's Dr. Tim. In this video, we're going to talk about ethnic rhinoplasty. We'll cover what it is, how it works, how it compares to similar procedures, what you can expect during the recovery process. Ethnic rhinoplasty encompasses a variety of different procedures based upon the ideology that a lot of the traditional ideas of rhinoplasty really just emphasized more of a Caucasian nose and didn't really take into consideration the fact that the appropriate aesthetic varies across locations geographically as well as culturally. And so ultimately, the goals for an ethnic rhinoplasty are not that of a traditional reductive rhinoplasty. In general, depending on where you come from or where your family is from, that your goals for surgery will be different. These procedures can be performed open or closed. Open procedures include a little incision across your columella and allow us a little bit better exposure, but many times the procedures can be performed either or depending on the goals of the surgery. As we start to look at more specifics, if we look at patients of Asian or African descent, in general, people are looking for a higher dorsum. That they want there's a little bit taller dorsum there and maybe more tip projection to give us a little bit more definition, both in that anterior view as well as in their profile. The ways to be able to do this also vary significantly from traditional rhinoplasty. In a traditional rhinoplasty, particularly at the first surgery, it's very common to have sufficient material or graft material in the form of cartilage from that septum to be able to build up the nose or add additional strength. This is not the case in patients of Asian or African descent. And so many times there's further complexity as we need that material to come from somewhere. It could be ear, rib, or donor cartilage. But ultimately, the process is still very similar, though the aesthetic is different. At the time of your consult, when you come in, we're going to review your health history as well as your nasal history. I'd like to know if you have seasonal allergies or sinus infections or nasal trauma, because all these things will play into it. We want to make sure that we're all on the same page, that we understand the goals of the surgery so that we're adequately prepared and that we have everything we need to be able to give you the nose you've always wanted. Let's take a look at a couple of cases. This is an interesting case of a gentleman who had already had a rhinoplasty, and another doctor had put a piece of silicone onto the dorsum of his nose. However, it had not given him the dorsal height that he desired. What we discussed was the use of rib cartilage to be able to further enhance his dorsum and give him additional tip projection. During the surgery, we were also able to narrow his nasal bones as well as his ala and overall give him the nose that he desired. You can see here at 3 months that much of the swelling has resolved. His dorsum is where he wants it to be, and his tip, though still swollen, shows much better projection than he had previously, and he is well on his way to healing up. This patient has a Middle Eastern heritage, and though she has already had one rhinoplasty with a different doctor, she has not yet achieved her goals. So when she came to see me, she was concerned about a persistent bump on the dorsum of her nose. She also complained about a plunging tip when she smiled. She did not want to have her own rib graft or rib cartilage used, and so we were able to use cadaveric or donor rib cartilage to be able to get all of the material that we needed to be able to strengthen her nose, refine the dorsum, and give her the tip that she desired. You can see her here at 3 months with a beautiful dorsum. The tip is still a little bit swollen, but overall she's doing wonderful and she's very happy with her results. Recovery following your ethnic rhinoplasty will vary depending on the location where we have taken graft material from, whether it's your ear or rib, but otherwise, in general, typical pain scores are very low. Facial discomfort is usually scored maybe 1 to 2 out of 10. You'll have a splint on your nose for the first week. And sometimes, depending on the type of graft material that's been used, we may go ahead and have some little sutures that are on the outside of the dorsum of your nose, or even along the bottom. As we start to control more of those elements of your nose, there may be some little sutures even along the ala. And so ultimately, from that standpoint, those sutures come out at 1 week. We do want you to wear that splint for the second week while you're sleeping at night, just to make sure that you don't hit yourself in your sleep. We will expect in certain types of ethnic rhinoplasty to have a little bit more swelling than may be typical for a traditional rhinoplasty because of the amount of surgery involved. Either way, we want to take care of you and be thoughtful about whatever your aesthetics and goals are. So if you've been considering an ethnic rhinoplasty, we would love to meet with you so that we can create your unique plan to be able to achieve the goals that you have in mind. We look forward to meeting you.